Welcome to the January meeting of the PRCA West Alabama chapter. This is our first time being together for the new year, so thank you all for joining us today. We'll go ahead and get started. More than likely, a couple more people will start trickling in, but let's go ahead and begin. First thing we wanted to do is to see if anybody present is not a member or if this is your first time joining us. I believe I recognize most of these names, but is anybody here for the first time? I don't think so. We got a bunch of oldies and goodies here, so that's a good thing. Thank you all for joining us. Please keep in mind that these meetings are open each month for being able to bring guests. Even though we're meeting virtually, they are welcome to join us. If they like the presentations that they see each month and they see the value of this group, maybe they'll decide to join us whenever we're able to be back in person. So be sure to invite your friends from locally and heck, across the state or the world if they want. This is always valuable information that we try to share in the PRCA group. Just know that these meetings are recorded, so they are available on YouTube afterwards if you want to refer back to this presentation. I didn't even introduce myself. My name is Megan Galavies. I'm with Alabama Public Radio and I am our president-elect. Miss Amy Matterson is our president. She was not able to join us today, but she wanted to send her well wishes and let everybody know that she will be back with us as soon as possible. So I am going to just hand it over to Miss Susan Poole, who will introduce our guest speaker for today. So Miss Susan.
Hey, good morning. I'm so glad to see everybody. Welcome to 2021. We're looking forward to having a great year. We've got a great speaker to kick off our new year. Jamie McLynn is joining us today from Birmingham. She is a UGA grad with dual degrees in advertising and sociology, and she spent 4 years bringing camp programming to hospitalized children's bedsides for the Hole in the Wall Gang Camp, a camp for kids with serious illnesses based in Connecticut. She was then Special Projects Coordinator at the Community Food Bank of Central Alabama, and she took on projects like grant writing and program planning and evaluation. In 2019, she joined Children's Hospital as a Community Development Coordinator on the Corporate Partnerships and Cause Marketing team with the foundation. Jamie lives in Birmingham, and I had the great pleasure of working with her last fall on a project that we were doing, and she and her team are just wonderful to work with, and I knew that you guys would enjoy hearing from her. And she's going to be talking with us today about cause marketing during the pandemic. So Jamie, thank you so much.
Thank you for that introduction, Susan. I'm excited to be speaking with y'all today. Like I said, excited to have a reason to put on a blazer. So thank you for having me. Let me share my screen. As Susan said, I work at Children's of Alabama in our foundation, and I'm on our cause marketing and Children's Miracle Network Hospitals team. So we are a Children's Miracle Network hospital, which means we're one of 170 network hospitals across the country. As part of this network, CMN Hospitals is primarily a fundraising organization and brokers partnerships at the national and local level for local hospitals to engage with and fundraise with. And that's how I got to know Susan and the Westervelt Company through our Log a Load for Kids partnership. So just to give you a little background about our hospital, we are one of the 10 busiest pediatric hospitals in the US. We're one of the largest by size as well, by square footage, the only freestanding pediatric hospital in Alabama. So we're treating kids from all over the state and the region. One of my favorite facts about us is we use about 4,000 crayons per week, just to show you where our focus is. It's always on the kids and treating them, but also making sure that they feel like a kid when they're within our walls and receiving treatment from us. We I just like this fact as well. We have 25 different sizes of blood pressure cuffs because one size does not fit all when you're treating infants to young adults. At a normal adult hospital, there's probably 3 sizes of blood pressure cuffs, just to give you some context. And to give you some local context for my West Alabama folks, we had 12,700 patient visits from Tuscaloosa County alone in 2019. So we really are not just Children's Hospital in Birmingham. We are Children's of Alabama, treating this entire state and region. We have kids coming from across the border in Mississippi, from all over, because we have, I want to say, 9 nationally ranked specialty divisions at this point at Children's. So to zoom in on what the foundation does, the fundraising arm of Children's of Alabama, we have a pretty diverse portfolio of the ways in which we fundraise. This chart is from 2019. So our 2020 numbers did look a little different than this. Mainly, we were not able to host events. And so our CMN hospitals and cause marketing, which is what I work on, actually made up about 25% of our fundraising in 2020. We're obviously not the only thing that's bringing in money at Children's of Alabama, but the wonderful thing about the majority of our fundraising is that it goes to the hospital's greatest need. And so we're able to address things that are not typically covered by insurance or from other revenue sources. And that really typically is making sure that the whole child and their whole family is being taken care of by child life services, pastoral care, social services, things like that that don't get reimbursed by insurance. So I told you what CMN is. These are just some examples of the corporate partners that we work with. These are partnerships that are brokered at the national and regional level for us. And then at Children's of Alabama, it's our responsibility to execute these partnerships at a local level. We own the Birmingham territory, which covers most of our state. So we have coordinators like me all around the state working remotely that really partner with their local areas to execute these fundraising campaigns and cause marketing campaigns. Oop, where'd I go? There we go. So everyone's hearing or sick of hearing about unprecedented times. I wanted to just give you an idea of what cause marketing looks like for us during precedented times. We really focus on our brand is our patients and their success stories and their stories of healing. So we really focus on our materials and our communications with cause marketing partners, just our patient stories. We produce materials like this, patient story posters, lanyards. I'll show you a few more example photos, but it's all about our patients. And this is why we do these partnerships, to raise money for better care for these kids. We also like to focus on keeping it local. Even though CMN is a national organization, every dollar we raise within our territory stays in our territory and stays in our hospital serving local kids. And that's really important to our corporate partners and local partners, that they are investing in their community's kids when they partner with us. We also try to keep things fresh. We have partners that have been fundraising for us for 20 plus years. And so we try to help them meet new patients, meet new kids, learn new things about the hospital every year. And we also like to keep things just visually fresh. So this whole theme of the PowerPoint was our this like red and blue color scheme and the slogan, caring for local kids. That was our theme in 2020. And our partners just got all fresh materials, new patient stories, and really get to latch onto this theme. And then in 2021, we debut a new look and feel, and it just keeps things exciting for, you know, those cashiers and frontline folks that really care about fundraising for children's, but might need a little excitement year after year. One of the hallmarks of our cause marketing spiel is that doing good is good for business. And we really just come back to that time and time again, that when you partner with Children's of Alabama, it ultimately reflects wonderfully on you as a business. So these are some of those materials I mentioned. Again, patients and kids are the forefront of everything we produce and give to our partners. This was, again, our theme for last year. We sometimes do t-shirts for different partnerships. You might visit your Costco in Birmingham and be offered to buy a t-shirt, and the funds will go towards Children's of Alabama. Let's see, who wears lanyards? I think our friends at Publix like to wear these lanyards at the cash register. So this is just how we keep things fresh and exciting for folks year after year fundraising for us. Again, this is that doing good is good for business. We use these stats to pitch to new corporate partners when we are trying to convince them that a partnership with us is a good idea. And we also use some of these statistics when we are training those frontline workers like cashiers. We're helping them to understand that making the ask at the register is a good thing, that customers want to be asked. They enjoy helping in this way and giving to charity in this way. And it just, we want to make those employees and associates feel empowered and feel good about what we're asking them to do at the register. So pivoting, another favorite word of 2020 and 2021. What does this all look like during a global pandemic? So we decided to focus on a few things and pivot away from a few things. One of the things we focused on is that a cause marketing campaign or a corporate partnership really boosts employee engagement. Employees are proud to work at companies that have a cause, take a stand for something good, and it can give them something exciting and good to focus on, even and especially when times are stressful. One example of this is that our Walmart campaign, and Walmart is our largest corporate partner at Children's. Our Walmart campaign was one of the first campaigns that took place peak pandemic. It was last mid-June. Lots of fundraising had been really on hold until that point, and we were just very unsure of how this campaign was going to go. Typically, our Walmart folks love fundraising for Children's, and they do crazy things for us. They wear crazy costumes, they host barbecues, they host car washes, lots of in-person things that could not happen last year. And so we were really nervous, but we found out that this campaign was a wonderful way for them to focus and turn their focus from the stress of being a frontline essential business. If you remember in June, like, it was so stressful for our Walmart friends. They had boarded up windows, lines out the door, some people wearing masks, some people not wearing masks. And the CMN campaign really gave them something good to focus on and turn their attention to. So that was a wonderful example. We also focused on just changing our messaging a little bit. When you are raising funds for Children's of Alabama and for CMN, you are taking a part in this pandemic. Kids can't wait for a vaccine, for the curve to flatten, for an economic boost. Those were just some of the slogans that CMN nationally was pushing out to encourage folks to give during this time. Here at the local level at Children's of Alabama, we were focusing on messages like heroes work here, and we have frontline heroes working in our hospital. And all of these messages combined were really helpful to us during our campaigns over the summer and throughout the course of the year. And people were really able to latch onto them. We also obviously had a huge groundswell of public support for health causes last year, which was wonderful. CMN at the national level did a survey in June 2020, again, kind of peak pandemic, and found that children's health was #2 in the nation for social issues and causes, and that 40% of Americans ranked it as their top 3 causes. They also found that charitable giving was up, even though people were facing economic hardships, job uncertainty, health challenges, 71% of Americans in June had given to charity in the past 3 months. That's an incredible rate. So we were encouraged by the fact that rates of giving were high despite hardships. We were able to communicate with that with our corporate and cause marketing partners who were unsure if they wanted to ask folks at the register at this time. We said, yes, people still want to give. They really want to give more than ever. And just giving a few dollars or a few cents at the register is a really great way for people to feel like they're making a difference without really opening up their pocketbook and writing a huge check to Children's of Alabama. Another stat we used with folks was that 53% reported giving at the register when checking out within the past 3 months. So that helped us pivot to really focusing on rounding up at the register. We had the stats. We knew that folks were trying to shop quickly and get out quickly, and that just quickly rounding up their purchase to the nearest dollar rather than filling out something to like do an icon that hangs on the window. You've been asked that before, or some more complicated ask was perfect. Round up at the register was the perfect thing. And it was also really good for our partners that had shut down their stores. I'm thinking of like Dairy Queens. They shut down their restaurants, but their drive-throughs were still open. So it was really easy for them to quickly do roundup at the register without slowing down that drive-through line. So we really, really pivoted to and focused on asking our partners to do roundup at the register. We also switched to online giving. We saw a boost in online giving throughout the pandemic across the board in the foundation. And then with our corporate partners, a few of them for the first time ever allowed their customers to donate online when making an online purchase. This was huge for us, especially with partners like Walmart, where people were doing online grocery ordering and using the curbside pickup or grocery delivery. So many people switched to that mode of shopping during the pandemic, and the fact that our corporate partners thought to and were generous enough to turn that on their websites really made a huge difference for us in our fundraising numbers. The other thing we had to pivot to was virtual cause connection. We always want the people fundraising for Children's of Alabama to feel connected to our cause, understand where their money goes, and feel good about what they're doing. So typically that looks like us popping in to a store location and giving them some goodies and just reminding them of what they're doing and why they're doing it. Or it looks like them coming to the hospital for a tour of the hospital, or having special events like a big giant pep rally to get our Walmart folks excited for their month-and-a-half long campaign. We couldn't do any of that. So we had to, like all of you, switch to virtual. And for us, that looked like having an online Zoom pep rally where we got some doctors at the hospital level to speak to Walmart and do some other fun things to get them ready for their campaign, all on Zoom. That looked like asking our patient families to hop on a quick 10-minute champion chat. We call our patients champions a lot. A champion chat with a credit union who was doing a fundraising push for us. And just, they did a little Q&A asking about, what's your favorite Disney princess? Just little things like this that made our partners feel connected to what they were doing, even over a computer screen. And we will continue to do all that virtual cause connection this year for sure. Looking ahead, there's lots of challenges this year. I think one of our biggest challenges right now is balancing our messages. You know, the hospital has limited real estate on social media, traditional media, how we're communicating with the community. And, you know, the fundraising side of us would love to push, please go donate. But we also have messages like, please go get vaccine. please bring your kids to the hospital or to the doctors for their regularly scheduled checkups. Don't be afraid to bring your kid in for their flu vaccine or their, 2-year-old checkup. So we have a lot of not competing, but just many varied messages that need to go out to the public right now. So fundraising is just not always going to be top of priority at the hospital level. We're also, this is ironic because we're on Zoom, but you all know it. Everyone has Zoom fatigue. Everyone's tired of tuning in for an optimistic, rah-rah, hour-long Zoom thing. Nonprofits all over are facing this. And so how are we going to connect with our donors and partners this year without just getting them tuned out, keeping them interested in our cause without having constant hour-long Zooms? We're still figuring that out. If you have any good ideas, let me know. We are going to try to do quicker, smaller things like those champion chats I mentioned, where we just connect a partner with a patient and their parents for just 5 or 10 minutes at a time. And just that little dose of really cute, inspiring, encouraging kid content might just be the dose they need. We're also, we have a few patient families that really work with us on our CMN campaigns. This is Logan in the bottom left corner and Gabby in the top right. They're our miracle kids this year, and we've equipped them actually with tripods for their phones and microphones. I couldn't remember if we gave them ring lights too. I think we thought that was a little too much. But now they're equipped to be little content creators for us. If we ever need, Walmart's kind of lagging in their fundraising, let's send them a quick little video message saying, thank you for all you're doing for Children's of Alabama. And Logan can quickly record that at home and we can quickly get it out to our partners. So we're experimenting with some new ideas here, but Zoom fatigue is a challenge. Also, just have to stay top of mind. There was that huge groundswell of support right at the beginning of the pandemic for children's health causes, and a lot has happened since then. We've gone through an election cycle. People are sick of talking and thinking about the pandemic. And so how can we position Children's of Alabama in the top of folks' minds, even now? It's kind of why this is our 2021 theme that will be rolling out new materials, new t-shirts, all that fun stuff. And we chose the tagline for Brighter Futures, just because we're hoping that this year looks a lot brighter for a lot of people, including our patients at Children's. So we are optimistic. We will keep looking ahead. And we have some really cute, as you can see, kid content coming out this year to just let people know that their dollars make a difference in the lives of kids like Logan and Gabby. Are there any questions? I'll stop sharing my screen.
Yeah, I'd like to ask a question.
Yeah.
I'm also, we do fundraising, of course, at the nonprofit that I'm with. And I wanted to know if y'all have taken on any new fundraising techniques or just anything that you've had to be forced to do because of COVID, but it's worked well and you can see it working into the future and that you'll actually keep even post-COVID times. Have y'all anything that's done really well like that?
Yes. Some of our virtual engagement strategies have turned out to be just so much easier on our end than hosting. I think I mentioned that virtual or the pep rally we do for Walmart. That was previously like a 400-person event in person, huge expense, a lot of work. We will, I think, always do that event virtually now. For a lot of reasons, but we do need to figure out how to make it that still like pep rally style, fun, rah. Still working on that part. Another thing we've really narrowed in on is our virtual, like our e-communications. We have a new e-newsletter just for individual donors at the hospital. That's going pretty well. Previously, we barely ever emailed our donors. And we are working on a similar newsletter for our CMN partners as well. Also just sending during a campaign, during a month-long push, we're sending an email every week with a new patient story and a new fundraising tip. We're also using mobile text alerts this year, so people can sign up and they get text messages from us. We're figuring out a lot of ways to use that. Yeah, nothing, nothing like amazing or groundbreaking.
But just expanding on the things that you've done before, maybe a little bit, but coming up with new ways to reach more people with technology.
We relied on the in-person a lot prior to this. Yeah. So figuring out new avenues of communication.
Great, thank you.
Jamie, I had a question on the, you mentioned the donations at the register. Mm-hmm. Any idea what percentage of the funding that you get comes from customers just donating at the register? And have you seen a change in that in 2020 over previous years?
That's a great question. I don't even know if we'd be able to figure out what percentage or what dollar amount came from at the register. Obviously, those donations are smaller, right? If your purchase was $1.60 and you round up to $2, that's only a 40-cent donation. So we really emphasize to folks at our cashiers that they have to ask every customer every time, and that's what adds up. I think the biggest change was that more partners adopted the roundup feature of the campaign more than ever before. I'd say we probably had 3 or 4 partners add on roundup that had never done it before. The national change shortage, there's a coin shortage, that also helped us actually, because our retailers wanted people to not get change. And so the roundup, it was good for saving coins, I guess, and good for us.
Any other questions?
I just wanted to say real quick, I'm sorry, Susan, to interrupt you, that I do like the idea of contacting your donors separately, because we have a variety of donors for our organization, and we contact them maybe twice a year. Mm-hmm. And if they're on our email list, then they receive our normal regular emails. But I do like the idea of tailoring. I mean, can you talk just real quickly about, how that message to them may be a little bit different? Are you talking to them more about, here's, thanks for the money, here's what we're doing with the funds that you've offered us? Or what kind of messaging are you doing that's different just for those who are donating to you?
Yeah, our donor email, we try to make it a mix of, this is how you can support the fundraising, and outright asks and news they can use. We know most of our donors are parents, and so we've been sharing podcasts and articles about health tips for kids or parenting during the pandemic. We share news updates from the hospital. This doctor was in the news for this groundbreaking research. So we really try to make it a mix. It's not all foundation news. It's not all, here's how you can help. And we don't do an outright ask. We maybe do one per quarter in that newsletter. It's not an ask every time. So we hope they'll keep reading. And it's a lot of patient stories. I will say we do a patient story in every single email.
That's awesome. If there aren't any other questions, Jamie, thank you so much for coming on today. We really appreciate you kicking off our year and sharing the story. And we certainly wish you guys well in 2021.
Thank you so
in
much.
your efforts.
Round up at the register when you're at Walmart.
Absolutely.
Thank you guys so much for having me. I really appreciate it.
Yes, ma'am. We appreciate you. Thank you so much. And everybody else, thanks again for joining us for our first meeting. We will do this each month, so please come back. Does anybody in the group have any announcements that they want to share with anyone? No? Everybody's good? Well, all right. Well, happy 2021, everybody. And we will see y'all in February. And everybody have a good day.